Urethritis is an infection that affects the urethra. The urethra is the tube that carries urine from your bladder to the outside of your body. When you have urethritis, this tube becomes inflamed and irritated. This can cause pain and discomfort, especially when you pee. Urethritis is a common infection that can affect both men and women. Urethritis is usually caused by bacteria. These tiny organisms can enter the urethra and cause an infection. Sometimes, viruses or other irritants can also lead to urethritis. It's important to remember that urethritis is treatable, and most people make a full recovery with the right medication. There are two main types of urethritis: gonococcal urethritis and non-gonococcal urethritis, or NGU. Gonococcal urethritis is caused by the bacteria Neisseria gonorrhoeae, which is the same bacteria that causes the sexually transmitted infection, gonorrhea. NGU is caused by other types of bacteria, such as Chlamydia trachomatis, which causes chlamydia or Mycoplasma genitalium. It is important to determine which type of urethritis you have so that the correct treatment can be given. Symptoms of urethritis can differ between men and women. Men might experience pain or burning when urinating, a white or cloudy discharge from the penis, or itching or irritation around the opening of the penis. Women may experience similar symptoms, including pain or burning when urinating, a frequent urge to urinate, pain during sex, and abnormal vaginal discharge. If you suspect you might have urethritis, it's important to see a doctor to get a proper diagnosis and treatment plan. The doctor will ask you about your symptoms and medical history, including your sexual history. They will also perform a physical examination. To confirm the diagnosis, the doctor will likely perform a urine test. This involves collecting a sample of your urine and examining it for the presence of bacteria or white blood cells, which indicate infection. Additionally, the doctor may take a swab from the urethra to collect a sample for testing. This is a simple procedure that involves gently inserting a cotton swab into the urethra to collect cells and fluids. The treatment for urethritis typically involves a course of antibiotics to eliminate the bacterial infection. The specific type of antibiotic prescribed will depend on the type of bacteria causing the infection, which is why getting tested is so important. It's crucial to finish the entire course of antibiotics as prescribed, even if your symptoms improve before completing the medication. If you are diagnosed with urethritis, it is essential that your sexual partners are also tested and treated if necessary, even if they don't have any symptoms. This helps prevent the spread of the infection and reinfection. Preventing urethritis involves practicing safe sex by using condoms consistently and correctly every time you have sexual intercourse. This helps reduce the risk of contracting sexually transmitted infections, including those that can cause urethritis. It's also crucial to avoid having sex until you and your partner or partners have completed treatment for urethritis to prevent spreading the infection.